Mr. Chairman, whenever you're ready.
Can you guys hear me now?
Yes, we can hear you.
I'll take that as a yes. My name is Will Shorter. I'm chairman of the Board of Trustees. It is 5:03. I call this meeting to order. First off, we'll do a roll call vote.
I think we need to get some feedback from
Rudy, we're having a lot of feedback.
Few people still aren't muted.
All right.
No, I'm sorry.
Skip, I believe it's the PC that's in the conference room that's not muted yet.
Mr. Rodella, we are having all kinds of feedback in this room. Do I need to move to a different room? Rudy, do I need to move my computer to a different room? Rudy, you are muted.
Yep, sorry about that. Yes, I think that might help. It's either the one of those devices in that room is not muted.
Let's try this. How about now? Rudy, I'm still getting a lot of feedback.
Hey, Will, I'm getting into your computer.
Skip, if you're still having problems, you might want to just turn the computer, just get out of the session on the computer and call in by telephone.
How about now?
Oh, now it's perfect now.
Perfect. All right. I'm sorry, everyone. Thank you for your indulgence. Again, my name is Will Shorter. I'm chairman of the Board of Trustees. I again officially call this meeting to order at 5:07 today in, for a full board meeting. I will do a quick roll call. First Vice Chair, Joyce Miller. Here. Second Vice Chair is Rob on the line. I see Rob.
I am, yes.
I see Deidre is on the line as well, our treasurer.
Yes, here.
Barbara Maxwell, our secretary. Penny Evans. I believe she's on the line. Simona.
Present.
Leslie
Here.
Anderson.
Present.
Tanya, I believe, says she cannot make it today. Joan Beck. Here. Kathy.
Here.
Joe Bless. I see Joe. Laura Brown. Not here. Jim Harley.
Here.
Here. Don Rowland could not make it today. Jacqueline Seaman is here. And Jenny Lane is not here. Sandra Solomon is not here, I believe. And Gerald Starr is here, I believe. I believe that we have quorum, if I'm not mistaken. Let me check. Yes, we have quorum. So first order of business is, I'm sorry.
Sandra Solomon is here.
All right, thank you. First order of business is approval of the agenda. Do I hear a motion to approve the agenda?
So moved.
Penny,
Penny.
is there a second?
Second.
Second.
Joyce Miller, all those in favor, signify by raising your hands.
Aye.
Aye.
Those opposed? So, I'm sorry, Deidre, was that in opposition or?
No, I was just a little slow. Sorry. I had
Okay, I
to get
just
back
wanted
to my
to make
camera.
sure. All right, so it was unanimously approved. Also, please excuse me, we had two candidates with us today also that I neglected to introduce in the beginning of the meeting. Brooke and Delax, who is also joining us. So they're getting their first taste of our work. So thank you for joining us, and we welcome your participation in this meeting today. So feel free to chime in, and we look forward to working with you during the course of your term. So, and for the sake of time and trying to get through most of the discussion, and once we get to the COVID response, which is going to take the biggest chunk of our time, I was hoping, and if it's all right with the members of the board, I would like to do a consent motion for the action items for the items we have here, from the motion to approve the reclassifications to motion to transfer the funds from the for the IT vulnerability audit. Is there any objections if we have a consent vote on those after staff explains them?
Just
Aaron?
one
Mr. Arnold?
comment, yes. One comment is for the reclassifications. I'm concerned that the county is going to need to do a lot of budget trimming, and whether or not increasing some position salaries is appropriate if that happens.
Well, okay, let's do this. If there's concern and there's about that, let's hold that off on its own, and then we can vote on everything else. So we'll pull that out, the consent. So, Mr. Roundtree, if you can discuss, the approval for reclassifications, and we'll take that item up first, and then we'll go on to the other items. If anyone has any other objections, then we'll go from there. Okay? All right, Mr. Roundtree?
Sure. Hi, Coven Roundtree, Chief of Human Resources. So we're seeking the approval of two reclassifications. The first one for the manager of the communications and marketing, and the other one for the executive director of the foundation. Both of those positions are currently part of the executive leadership team and have very similar duties to those on the executive leadership team who hold chief positions or grade 24. So the classification review committee have met. We reviewed the job descriptions and have really found that those two positions need to be graded on as a 24 or a chief level. The titles would change. The title would be the executive director of the foundation, AACPL Foundation, and the other one would be director of marketing and communications. So in a nutshell, that is kind of what we looked at. And plus with Ann Glenn retiring at the end of September, the market really kind of demands a higher salary range to be an executive director for the foundation. So we're hoping to reclassify that so that we can attract an appropriate candidate that can continue the excellent job that Ann has been doing.
Chair, may I speak?
Yeah.
So I heard Mr. Harley asking about the issue of the budget in this year. As I think everyone knows, we have been subject to the county's hiring freeze over the past several months. And due to that, we have seen significant savings. There are about 17 positions that have been held vacant up through the present. And we recently received the authorization from the county to go ahead and use our discretion, being conservative in moving forward with hiring in our positions. The difference in these starting salaries for these two positions is one thing, but keep in mind that we have an incumbent in the executive director position who will be leaving at a level. You can't really tell yet who we will attract or what salary we will need to provide, but it's a matter of a few $1,000s, maybe 10, maybe $20,000 difference on the high side, I would think. In the case of the director of marketing and communications, if you approve that, there is a provision in our policy that we provide a 7.5% pay increase or take the person to the minimum of the new classification. So in this case, that would be a 7.5% pay increase. We work all year to manage within our budget, and I feel confident that we will do so going forward if these reclassifications are done.
Thank you.
Mr. Chair,
Yes,
may I be recognized? Thank you. So I want to note that this has not been to the budget committee. However, I know particularly, I do support this. And in the case of the marketing director in particular, I have questioned this in the past, why this position was not at that level. So I support this motion, this resolution.
Ms. Beck?
Yes, I would certainly approve both of these, but I think it's especially critical on the position we will be trying to fill with Ann's position and Ann leaving, because the marketplace out there, you know, kind of we're in the backwater here in many ways. And we need to up our game a little bit if we're going to, in my opinion, attract some really top-notch, fiery person who knows the ropes and can move around the community with ease. So I would certainly support both of these.
Are there any other comments?
Thank you for your clarifications.
With that, I'll call for, Ms. Maxwell? You're muted.
Unmute, Barbara.
Yeah.
Can you hear me now?
Yes.
Yes.
Okay, thank you. In the write-up for the declassification or the reclassification for the marketing communications manager, it's specifically noted that no salary increase at this time is needed because that person is already being paid at the higher level.
I think that's a mistake we had in the write-up. I apologize for that, Barbara.
Maybe it was step increases that had taken care of it.
Whenever anyone receives a promotion or a reclassification of their position, then our standard procedure is to provide a 7.5% increase or take you to the minimum of the new classification. So, so there will be a pay differential there.
Okay, then that needs to be corrected.
Thank you for.
In the resolution that we'll be asked to approve, that needs to be corrected.
We'll adopt that as a friendly amendment.
Thank you.
Well, I think it's in there when they note the level of classification from 21 to 24 automatically means a difference in pay.
It could be because of a step increase or something. I'm just saying it did specifically note that no salary increase would be due at this time because the individual holding that position is already receiving, I'm assuming, more than the minimum 24 MA amount. It didn't go into any detail.
Mr. Chair, could the board have a moment to review the actual text of the resolution again so that we can see what
Yes.
Barbara's talking about? Thank you.
I'll give everyone about 2 minutes to just review it and.
Now, would you like it, Mr. Chair?
Yes, Skip?
Would you like for me to read the text of the motion?
Yes.
Okay, let me read it because the
That would be excellent.
The item that Ms. Maxwell is referring to is in the explanation, not in the motion itself. But it shouldn't be there. We should correct that. So, but here's what we're saying. Resolution of the Board of Trustees approving the Anne Arundel County Public Library reclassification, marketing and communications manager. A meeting of the Board of Trustees of the Public Library Association of Annapolis and Anne Arundel County Incorporated was held via Zoom on Thursday, August 13th, 2020 at 5 p.m. A quorum of the trustees was present. A majority of the members of the Board of Trustees adopted the following resolution. Resolved that a majority of the entire Board of Trustees of the library does hereby approve and adopt the attached recommendation for reclassification of the marketing and communications manager position from a 21 MA, which is management, to a 24 management. And it is further resolved that the salary plan effective July 1st, 2020 will be updated to reflect this change. This resolution of the Board of Trustees on motion duly made, seconded, and carried is approved. And then I'll go to the back side too, because this is the attachment that by reference is incorporated into the motion. So there is a table that shows the position, the current grade and minimum salary, which is $67,822. It gives it gives a different title. We actually want a different title here, so I'm going to make that change to the text here. It says it says Chief Marketing and Communications. This would be Director of Marketing and Communications. The reclass grade and minimum salary will be 24 MA, with the minimum being $84,255. And the variance in the minimum salary is $16,433. So reading the text, this position is vital to AACPL and an integral part of the executive leadership team. The position is currently classified as a 21 MA with a starting salary of $67,822. With the growth of this position and to meet the needs of its operation, the duties and tasks of marketing and communications manager position have changed and been realigned to mirror those of a chief 24 MA level position. A revised job description with those duties and tasks was completed and reviewed by the Classification Review Committee. With the level of work being consistent with a chief 24 MA and the position serving as a current member of the executive leadership team, we are recommending the marketing and communications manager position be reclassified to a director of marketing and communications position 24 MA. The incumbent marketing and actually, we'll strike that final paragraph where it indicates that a salary increase is not being proposed.
Oh, you didn't read that.
The part that we're taking out.
Yeah, you should read it so people can.
Okay, so the part that we're taking out is the incumbent marketing and communications manager is currently being compensated within the chief grade. A salary increase is not being proposed at this time. That's to be stricken.
Okay, so you're going to strike that. Do you offer that as an amendment, Ms. McElroy?
Mr. Chair, I'll move the amendment of the title of the director to title of the position to Director of Marketing and Communications and striking the final paragraph.
Thank you. Is there a second on that amendment?
Second.
All those in favor, please. Aye. All those against? Okay, the amendment's adopted. All right, are there any other amendments or discussion regarding the reclassification? Yeah. Here, Ms. Solomon? Hearing none, I call for a final vote. All those in favor signify by raising your hand.
Aye.
All those opposed? All right. Ms. Brown, is that opposed?
I'm sorry, I'm just a little delayed. I am for the amendment.
For the amendment and for final passage?
Yes, sir.
Thank you, Ms. Brown. All right. The resolution carries. All right, thank you. And with that, we're going to do a consent for the rest of the items. So if Mr. Roundtree and Mr. Rodila and I believe could explain the rest of the policies and motions that are coming before the board, then we can vote on them and we can have discussions as need be. So I will kick it off to Mr. Roundtree and Mr. Rodila.
Sure. Thank you. For the revision of the telework policy, we appreciate the passing of this. Previously, it's been very successful. But due to COVID and all the changes it's brought to the library system, we are asking that a revision be made to the telework policy. There is a line in the telework policy that says that individuals can only telework 5 days out of a pay period. So basically 5 days out of generally 10 days within a pay period. We're asking that we can remove that 5-day limitation to give greater flexibility to our staff who needs the social distance and also deal with all of the changes that COVID-19 has brought.
Thank you. And the next policy?
The next resolution that staff is asking the board to approve. Oh, by the way, I'm sorry. Rudy Rodella, I'm the Chief of Support Services for the library. The first item is ratifying the purchase procedures for the Bush Annapolis Opening Day collection. As you may recall, late last month, the executive committee took action on approving these procedures. In a nutshell, to summarize that, and I apologize to the executive committee, they're hearing this material all over again, but for the benefit of everyone. When the county makes a purchase of the scale that we were talking about for the opening day collection, they require the vendors be vetted through a competitive procedure known as a request for proposals. The county does not have an existing RFP approved vendor for books and library materials, but the library does. So the project team, which consists of the county DPW's project manager and myself, we decided that the more efficient and effective method would be to allow us to purchase the opening day collection through the library's operating funds. which would then be reimbursed from the capital funds through the project. We had intended, and this is completely my fault, I should have notified the board earlier. This is an extraordinary procedure for the operating fund. In this particular instance, although the overall span of the procedure, the reimbursement and the pass-through and the journal entries, all of that is a standard accounting procedure, which we currently use for other projects, just not for the Annapolis Library project. So we, because we had realized we had this oversight, we asked the executive committee to take the immediate action so that we could pay the vendor for the collection that has already been purchased and is already in the library. And now we're asking for the board's ratification of the executive committee's action on that.
Thank you. Your next two.
The next item is again, the approval for the purchase amounts for the opening day collection. Normally, the CFO will be giving this part of the brief, but he is out, so I don't have the exact threshold number available to me. But over a certain amount of money, we are required to obtain the board's approval to purchase. All of the opening day collection vendors, which you see enumerated in the resolution, they're all over the threshold that requires a board of trustees approval. So we're asking the board to approve these purchases, so that to approve these purchases for the Annapolis opening day collection.
All right. And the IT audit.
On the IT audit, we are one of the items that was identified by the board's cybersecurity committee was a need for an audit of the library's current cybersecurity posture. We have obtained a vendor, which we have actually obtained 3 quotes, which the cybersecurity committee reviewed, and we've made a selection. In order to finalize the contract, we need to transfer money out of capital outlay for computers into professional services, which is the actual line in the budget that this contract will be paid for. We see minimal risk in the capital outlay transfer because of COVID and the reduced public services. We are able to defer PC replacements for the next year, which allows us to use this funding this year for this cybersecurity review, which we completely agree is a much more urgent need.
All right, thank you. Are there any other questions or comments from the board members?
Mr. Chair, I just wanted to make one comment on the ratification resolution.
Yes.
I believe at the executive committee meeting, or actually it was the reason I had proposed we do a ratification at this meeting is because that wasn't done by a meeting, it was done by email, which was not a proper meeting, I believe. However, as treasurer, I understood the importance of the transaction and authorized it to take place, but was concerned that we needed to make sure that the actual board approval was done in a proper fashion under the Open Meeting Act. That was all I had. Is anybody waiting? I'm hearing just dead air now.
My question, Simona, is this duly noted in the bylaws that no such transaction can be done through email? If not, we need to duly note that. So for the future, it will be in writing.
So meetings normally have to be done in a fashion in which all the participants, public meetings have to be done in a fashion in which all the participants can respond to each other and hear each other's comments contemporaneously. All corporate board meetings actually are supposed to be done that way normally, unless there are special provisions. because you have to be able to hear the comments back and forth and be able to change your position possibly. So there's not actually any way to do a vote by email normally, because you can't have debate. So that was my concern, and I don't believe we have any provisions for any sort of email voting to begin with. So I don't think we need to make a prohibition on it.
I
Deidre,
will,
Mr. Harlan, then Ms. Beck.
yeah, I will make a review of the bylaws to see if there's anything that needs to be changed relevant to that.
Thank you. Ms. Beck?
Yeah, you know, maybe it's me, but I thought we discussed this by Zoom because I remember talking to people about the need for this. I'm very much in favor of it. So
It was actually talked about last winter, I think, or last early spring in a meeting as something that might have to come up, but it wasn't. I think it got ahead of some of the staff and had to come to an sort of an emergency meeting of the executive committee about 2 or 3 weeks ago.
right, that's what. Yes, that's
And
exactly
that meeting was done via email.
Are there any other comments or?
I have one more motion. Do you want me to go over that now?
Yes, please.
Okay, hi, I'm Kathy Hallerbach. I'm Chief of Public Services and Branch Management. Back in June, the board approved a motion to provide 10 free pages of printing a day for our customers until September 8th. We did that because of COVID, because of the closure initially, then the reopening, and a need to be able to provide basic services, but not have to have the staff touch the equipment and work closely with the customers at the equipment. So for social distancing and just for safety. So I am asking to extend that 10 free pages a day to December 31st. I think we were optimistic saying September 8th. And so, yes, so 10 free pages of printing a day and cease offering faxing and copying. So it's exactly what we have been doing. And this is not impacted by future decisions we make later today about our operations. In any case, we would still want this motion to go forward through the end of the year.
Thank you.
so moved.
Thank you. So what we're going to do is I will hear a motion to approve the consent items from approval to the revision to the telework policy to the printing policy. Is there a motion to approve?
So moved.
Is there a second?
A second.
All those in favor, please raise your hand.
Aye. Aye.
All those opposed? Motion carries. All right, thank you, everyone. So moving on to the COVID-19 response update. With that, before I turn it over to Skip, I just want to say typically during the summer, it's really rare that you would see the full board would really meet in this type of fashion. But as we're dealing with the COVID-19 and we're trying to monitor and assess our response to it, it's really appropriate that this conversation is a full board conversation and that we really have everyone's voice in this. So I just really want to thank, over the course of this whole response and as we're trying to discuss our next steps, Skip and his executive leadership team, of course, our staff who are in the trenches every single day, and our public health officials who are our partners in this. So I will turn this over to Skip and then we'll go from there, okay?
Okay, thank you, Will. Will, before we get started with what I wanted to say to kind of lay the background for this, I'd like to first welcome Dr. Nilesh Kalyana-Raman, our County Health Officer. He's with us, and as soon as I make my presentation, I'm going to turn to Nilesh to speak to the ways that we've worked together over the past 3 or 4 months to look at our reopening plans and to talk about the health and safety of staff and customers and all of that. I also just want to say a shout out hello to Dalix Cruz and to Brooke Toomey, both of whom have been nominated to join this board. And they will be, I think there will be a vote of county council on September the 7th. I know that the governance committee had a chance to meet with them. And so this board will have an opportunity to vote on their nominations at the September 17th meeting. I also want to do one quick shout out to Laura Brown, who I believe during this pandemic about a week ago, Laura was married to the love of her life. So is that right, Laura?
Yes, we got married August 1st.
Well, congratulations. I know we all wish you well. So
Thank you.
I guess we could all do a clapping, like raise your hands and clap for Laura and her spouse. Congratulations.
Thank you so much.
Okay, well, okay, everyone. So what I'm going to do, I want to read a statement, and what I'm asking you to do is to adopt a proposal. And I know that you'll want to discuss this very thoroughly, and you may have some ideas of your own about things, but I just want to kind of give you background. You've all received a huge amount of material. You've received the customer survey that 902 people responded to. You received the staff survey that 235 staff members responded to, including 200 from out in the branches where these issues are arising that are causing me to bring this proposal to you. You've received usage data. We've had roughly 2,500 to 3,000 people a day coming into our 16 libraries. So there are a lot of people who have been very appreciative that we have this, this opening. And at the same time, I've worked very closely with Kathy Hollerbach over the last few weeks, as well as all of the branch managers and regional managers. And she has worked out a way that we think we can provide practically all of the services that we're providing now and do them in a much better way. The stresses on staff are just enormous. The difficulties in mask enforcement are enormous. And so I want to read a statement and then talk to Dr. Kalyana Raman to ask him to speak to the group. And then we both are available to take questions. So July 6th was a wonderful day for our library system. We opened the doors after being closed for almost 4 months. What started out as sunshine and roses has evolved into a far uglier scene. Staff are being called names, cursed at, and threatened by customers in an attempt to do them harm. Police have been called out at least 4 times for particularly egregious incidents involving these mask avoiders. Instead of our staff being able to make recommendations for good books or planning the virtual programs that have been so successful or providing computer assistance, they are spending a tremendous amount of their time having to remind people how to wear masks and what is safe social distancing. In fact, managers have reported that staff have had to intercede with non-compliant customers hundreds of times since July 6th. I think it's in the range of 500 documented times in logs that the branches are keeping. That is unacceptable, and it's really untenable and unsustainable for our staff's greatest resource, which is the staff, for our library system's greatest resource, which is the staff. Many staff fear for their health and safety. In an employee survey that we conducted last week, more than half of the respondents indicated that they felt safe at work only sometimes, rarely, or never. One of the most reported concerns centered on employee safety in small staff workrooms. This was in many of the comments that we received. We also discussed these concerns with health department officials last week. So some of, Dr. Kalyana Raman's deputy health officer and another person from the health department who we talked with last Friday. They now are advising us that having people in closed quarters for long periods of time, such as these staff workrooms, could lead to virus transmissions. So for example, if any of those staff members get a positive case, we pretty much would have to quarantine everybody and close that branch down. That hasn't happened, but that that could lead to that. So we were told that we really need to spread out our staff. The only way to do that is to use some of the public area. The issues of safety, coupled with an uptick in the number of customer behavior issues, have led me to come to you today with this recommendation that we move to a more controlled library operation starting on Monday. Specifically, what I'm calling for is Curbside Plus. It's a Curbside Plus service model. So we had Curbside that began on June the 6th, and then we reopened on, it began June the 8th, and then we opened up on July the 6th. We're going to have more than what we had that first time we opened up with Curbside. We want to increase the hours of pickup availability and then control access into the library. So we're not eliminating people's access to the libraries, but we want to control that access through appointments. We would, this coming Monday, immediately increase the curbside service. It would be from 10 a.m. to noon and 3 to 6 on Monday through Thursday. Then it would, on Friday and Saturday, it would be 10 a.m. to noon and 2 to 4 p.m. Then September the 13th, when we start our normal regular Sunday hours, we would offer the curbside service from 1 to 5 at those branches that are normally open on Sundays. In addition, we would offer free wireless printing up to 10 pages through the library's app that we have. We would offer telephone and email assistance for research, book recommendations, and more. On September the 8th, which is 3 weeks from Monday, that's when we would start offering limited appointments for 3 primary things: browsing the stacks, using library computers, and librarian assistance, getting help from our staff. We also expect soon to be able to start offering laptop checkouts with mobile hotspots, so Chromebooks plus a hotspot to be checked out, a website chat for reference help, and then book recommendations and virtual assistance from a librarian using Zoom. So that would be starting next month. In addition to that, our staff who truly are our greatest resource, they're also incredibly innovative and creative and inventive. They are coming up with all kinds of ways to serve our community in a safe way. So I want to be clear, moving to this more limited service is not a decision that I take lightly. I realize the impact it has on our customers, the vast majority of whom are doing the right thing. I also recognize that based on guidance from the Anne Arundel County Health Department, we opened last month despite no other Central Maryland library system even having a plan to open. They pretty much are looking out into the future, but we opened because of the guidance that we had. We were told in May that it was reasonable for us to open in June, and we delayed that up until July the 6th. So I believe, and the entire executive leadership team believed at the time, that we could open safely. And what we did not account for were customers who would regularly put the health of our staff at risk. So I believe it's necessary to more tightly control access for the time being. We can continue to serve the needs of our community in a way that is safer for staff and customers. And with that, I ask for your support. I would now like to recognize, actually, I'm going to go ahead and say it. In Anne Arundel County, we have our own Dr. Fauci, and his name is Dr. Nilesh Kalyanaraman. He's better than Dr. Fauci. So Nilesh, if you could say a few words, thank you.
That's far too kind of an introduction, but thank you, Skip. Thank you for having me here today. Excuse me. As Skip noted, he and I have been speaking frequently throughout this pandemic, as have our staffs. And in the run up to the reopening of the library, we had a number of conversations about the library's reopening plan. I believe as early as May. And our take on it was very much, as long as you feel that you have the staffing and the the staffing and the logistics in place to be able to open safely based on your plan, that it's reasonable to do so. And I know that obviously did happen, as Skip noted, in July. And I think the important thing to note is that the library, along with everybody else, really, this is an iterative process. We open, we see if we see how it's working, we tweak, we make adjustments, and we honestly have to react to what's happening, not just in whether it's the libraries or other institutions, but also in the community and what's happening in terms of cases. The measures in the plan were geared towards minimizing the risk of coronavirus transmission, but it also requires everybody to follow that plan, and that means that both staff and the public. As Skip noted, our deputy health officer and our director of environmental health, particularly, we're consulting about a number of different issues, particularly face covering requirements, and Skip noted the challenges staff were having around the enforcement of that, but that the face covering requirements are really a critical part of to reduce transmission. Office changes, including ventilation, potentials around appointments only, or limiting the number of people, and really just discussing a number of ways in which we could improve the setting. And from our perspective, this is really I think how we need to operate, which is we integrate the information that we have and we make some changes when they're necessary, to balance the need to provide services and to balance the need for safety. And it is an ongoing challenge. I think that the changes that Skip noted, I think address some of the challenges that the library system is facing, and provide a way to move forward in the coming months, coming weeks and coming months. And we'll learn from that as well. We'll learn from that what's working and what's not, and continue to tweak this. So that's what I wanted to share with you today, and I'm happy to turn it back over to Skip, or to take questions, whichever we want to do next.
Thank you, Dr. Kalyan-Raman, for that, and thank you for joining us and all of your hard work during these unpredictable times. So with that, I will turn it over to the members of the board if you guys have any questions or comments in response to anything Skip or Dr. Kalyan-Raman has shared. So are there any questions or comments?
Mr. Chair, I have a comment.
Ms. Hendrick, then Ms. Anderson.
Actually, a comment and a question. The comment is, I was, skeptical about us opening when we did. I unfortunately missed a meeting. I think maybe it was an executive committee meeting that it was discussed at, but I believe I voiced that to you, Mr. Chair, outside the meeting. But I'm very supportive of us throttling back on where we are and going and adopting this new plan. I do have a question that I don't think was addressed here at all, and that is, where are we with expanding the Wi-Fi services to the branches out into the parking lots? Because, and also, do we have more of the MiFis or the portable Wi-Fi devices, or are we still working with the limited number that we had from the Edgewater branch?
I think Skip or Rudy can best answer that question.
I would like Rudy to go ahead and respond to that.
Thank you, Skip, Mr. Chairman. We are almost complete with the parking lot Wi-Fi project. Today or tomorrow, the very last branch, which I believe is Linthicum, will be installed, and that project will be complete. So we will have outdoor Wi-Fi antennas at all the branches here before the end of the month. The hotspots are currently on order. We're still waiting for the supply chain to catch up with our requests. Those items, along with the Chromebooks, as you may imagine, are in high demand. So some of those are we're just waiting for the backlog to catch up with us, but we've made those requests already.
Do we have any projection on how long they'll be, and how many did we order of the Wi-Fi devices?
We ordered 50 devices total. We've got 2 orders in, one of 25 and then the second of 25. I unfortunately don't have that handy. I believe Scott Barter is on the call as well. If he could, if he's available, he may be able to give us a better date on when to expect those devices.
Sure thing, Rudy. Yeah, hi, this is Scott Barter, IT manager. We have actually received a batch of 50 Wi-Fi devices that I believe are being coupled with 50 Chromebooks, and that will be offered as a package. Those have been received. As far as any further orders for Wi-Fi devices that are not being bundled with the Chromebooks, I unfortunately don't have any information about those.
So, Mr. Chair, if I could just follow up my comment by saying I mean, that has no effect on my support for the change in the operations, but I am really concerned about the shortage of Wi-Fi devices that we have, I think. And, you know, we had our ones from Edgewater were fully out and on reserve prior to the pandemic. And we need a lot more of them.
And Kathy Hollebeck just put in the group chat that another 25 hotspots are also being purchased as well, just to make sure everyone was made aware of that comment. I will recognize Ms. Anderson, then Ms. Beck, and then Ms. Miller.
Hello, this is Leslie Anderson. I guess I have 2 questions. The first one is to your health department expert. I'm happy to hear that the library board is responding to your guidance and that you and we are monitoring the situation as it changes. There are spikes in coronavirus going in other parts of the country. And my own personal experience, you know, I've seen people not wear masks at public beaches and things. So my question is, in relation to other counties' libraries, I understand that like Enoch Pratt just went to Curbside. So what is our criteria? Like what would make us not or rescind what you've just proposed, which sounds really good? So what would make you go back to a full staffed library? And that's in relation to the New Bush Library, which I'm sure people want to see and use. And maybe the one in the mall, if that's open. So I know that was complex.
So Ms. Anderson, is that a question to me?
I think, well, yeah, possibly, yes.
Or to Dr. Kalyana.
I think together, since you 2 have talked.
So, okay. Malesh, do you want to take that one to start with?
Yeah, sure. I could start off. I mean, I could say that in general, what we are trying to do is articulate the safety measures that need to be in place, and then we leave it up to organizations and businesses to determine whether they can meet those and whether they feel that they're able to put all those safety measures in place. So we're not really there to say you should open or you shouldn't. Well, we will say if you shouldn't open if that's a blanket way to address, you know, out of control virus. But at specific levels, we don't say you should or you shouldn't open. Beyond, are you able to put the safety measures in place, monitor them, and continue to enact them? Where we are right now, in terms of the number of cases, you'll recall a little, actually almost exactly 3 weeks ago now, we put into place some additional restrictions in terms of bars and restaurants not being able to stay open indoors past 10 o'clock. closing the common spaces of malls down from gathering, and then decreasing the gathering, limiting the gathering sizes. Those were in direct response to the contact tracing data that we had in terms of what was happening. So when I say that, you know, we're looking and we're iterating constantly, that's what I mean. In this conversation around what the library can or can't do, that's really dependent upon the ability of the library to be able to manage all these different external and internal factors. So I can't really say more than that. We're really just trying to define the parameters. You have to decide if you can apply those parameters.
So quick follow-on question to that is the library an essential service? And what does that mean in this context?
That's not a question for me to answer. So I'm going to leave that to Skip.
Okay, thanks.
So libraries are defined in the Maryland Emergency Management Act as essential services. However, that was a definition that was created not for a pandemic, but for response from a hurricane or some of that type of thing. So from that standpoint, I think I would leave the idea of whether we're essential or not to the side. Of course, we're essential. We're essential in many ways, but in terms of the specific emergency management operation, I would just leave that to the side. That isn't entering into my calculations or thinking.
Sure.
In terms of your primary question, which is when would we go back to, I'm not sure that we would ever go back to the complete reopening that we did on July 6th, because I believe that once we start on September the 8th with the appointment-based services, we can use that system to expand or contract as needed, branch by branch, in a very localized way to each situation. So we're going to start out kind of gently and softly. I think some branches may even start taking appointments before September the 8th because they can. But in the branches where there's just been an onslaught of desire for the use of these libraries, where it's much more difficult to manage, we'll start on September the 8th. We'll start with a certain number and certain amount of time. And then I think we have some capacity to be very flexible in changing that over time. I think that if we got to, say, January or March or April or May of next year, and we saw that the numbers had just really scaled back, or we got a vaccine, that's the time when we would be looking to really do the full reopening and have the grand celebration of Bush Annapolis Library that we want to have at some point.
Great. Thank you. So my second question is with respect to the Chromebooks and the MiFis, is there a priority or a preference? Like if there's an underserved or, you know, whatever family who wants to reserve a Chromebook as opposed to, I don't know what your criteria for demand is. So it sounds like the resource is limited, and I'm just curious if people who are in the lesser whatever library systems, like I guess Glen Burnie or Millersville or whatever, if they get priority for those Chromebooks and those MiFis.
So I'm going to ask Kathy Hollerback to respond to this, but I'll just say that our basic system is a first come, first serve. And we think that rather than, for example, just allocating them to students, for example, who desperately need them in some cases, and their families, or rather than just sending them all up to Brooklyn Park or Glen Burnie or Annapolis or someplace where we have severe pockets of poverty and need, that system of a first come, first serve seems to work really well. But I think Kathy can explain this better than I can.
Thank you.
Hi, so that's basically what I would say is that we do a first come, first serve because we don't do an extensive quiz about why someone needs to bridge the digital divide. We trust that you're going to check out a Chromebook because you need a Chromebook to do whatever your business is or whatever your studies are. I think our focus is on getting the word out through a lot of our partners who do serve those communities to let them know that this stuff is available.
Yes.
And they help promote those resources to those communities. And then we are just working really hard to get out as many as we can using various funds through foundation, through the CARES Act money, through every way we can think of
Right.
to get more and more of these out there. We have gotten some questions about whether we would prioritize them for students. Certainly lots of students check them out.
Yeah.
The scale that's needed to supply Chromebooks to the students, I mean, they just ordered 45,000. That's not something we can completely support.
Right.
We certainly do our best to work well with the schools. And so I guess that's really the answer, trying to serve as many people as we can across all the populations, but letting them know that we have these resources.
Awesome. Thank you.
All right. Thank you. Does that answer all your questions?
Yep.
Perfect. All right, Ms. Beck.
There's no one more supportive of our staff than I have always been. So I want us to protect them at all times in any way. If we need to get them more help to do the things that they feel uncomfortable, I think we ought to do that. I understand where you're going with the situation right now, but let's be honest, the library can't exist this way. It's just, you look at the numbers, you just can't exist as an entity if you're not there to let the people in the doors. So we've got a long road ahead of us to try to make our services as available without being onerous as we can do. And the staff is going to have to work with the board. The county is going to be involved in everything. And of course, the county is going to be facing their own fiscal deficits. And so they're going to be maybe not as responsive to our needs going forward. But I am concerned about the long-time effect on those who need us the most.
Thank you. Skip, would you like to respond?
Yeah, Joan, it breaks my heart to have to retrench like this and retreat from what was a sort of a full-on opening of our libraries. So yeah, you're right. You look at the numbers, and our numbers have shrunken tremendously from what they were. Every trend is down, and so we're providing in some ways a shell of the service that we were before. We aren't doing any in-person programs. We have no meeting rooms. We're not a social gathering place. So because we've been forced into this situation, and it's pretty much for a long term until we are done with this pandemic, we're just trying to do the best we can. I think that the programming that started, keep in mind, we closed on March the 13th. I think we closed before any other library system in Maryland, or we were one of the first two. So we closed as soon as it became obvious. We decided on a Friday and that we were going to close that afternoon, and that was it for 4 months. But immediately that Monday, probably even that Saturday and Sunday, our staff were rising to the occasion of making this pivot over to virtual programming. We've had great numbers of people attending that. So this is going to be an ongoing long-term thing that's going to be great for our community. When you think of it, we would do programs at every branch for example, our early childhood programs, but you had to go to that branch, and it's a lot of work to get there. Now we're doing these programs and hundreds of people are able to attend. So there's some really good things that have come out of it. We will get through it. As Ann Glenn reminded a couple of us recently, the public loves their libraries, and when we get back to normal, they're going to flock back to us. It's just going to happen. We're not going to lose them forever, but we're not in a position to be able to do everything we want to do. And I do think that we're going to be able, with this appointment system, to be able to get a lot of people in. So it's not like people won't be able to get in, browse the shelves, talk to a librarian, get some help that way, use the computers, use the Wi-Fi even. But it is a heartbreaking situation that we're in.
After Ms. Miller, I will recognize Ms. Brown and then Ms. Solomon.
Okay, thank
Ms.
you.
Miller?
Thank you, Mr. Chair. First of all, I hear what Joan's saying, and I balance that out with the fact that we are in a situation where staff does not feel safe. I know I took a tour of the Annapolis Library a couple of weeks ago, and I heard it firsthand from staff. And I work in the hospital at Anne Arundel Medical Center, and I have the privilege of telecommuting until January. At first they said Labor Day, and now it's moved to January because they're worried about the safety of the healthcare personnel who are taking care of patients, and they're worried about us. So we can work until January from home, and luckily I can do my job from home. I support Skip in this move, and I think it's a wise thing to do given the situation. It's hard to control people who are not going to comply with wearing masks. It creates very dangerous situations for staff because they don't know how violent somebody's going to get. I mean, we hear about it in the news every day. They're frightened. They're also frightened for getting COVID from each other in close quarters. But my question does not have to do with that. I support it 100%. My question is, how are we going to publicize this to the public by Monday? Is there a game plan that we have if this is approved? I'm sure there is, but I'd like to know how we're going to do it so quickly.
With that, I'll turn it over to Skip and Christine.
Okay, and I'll just turn it right over to Christine.
So we've been making a lot of arrangements about how we're going to alert customers. If the board chooses to vote on this recommendation this evening and it passes, an email will go out immediately to all of our customers. That's anyone who's ever used the library and has an email address, it will go out. It'll also go out to our extensive press list, and it will be in signage that is at every branch. That signage is sitting in delivery bins, waiting to go out. So it'll be up on the doors on Monday. Staff additionally will be talking with folks certainly that come into the branch on a regular basis over the next couple of days. So that's the plan.
Christine, I should have known that you would have been 10 steps ahead of everything already. So thank you.
Also, I would just note that Christine has been in touch with the Capitol, and I believe that a Capitol reporter is covering this meeting today. So we may have something out. It may already be out. I don't know.
All right, Ms. Brown.
Thank you, Chair. My extended family, I have lost 6 people. And my uncle's funeral is Sunday. And every time I think I'm okay, someone else dies. And my cousin in Detroit, in her extended friend circle, she's losing a person every 3 days. People are dying of COVID-19. And it is wreaking havoc on every aspect of our lives. Montgomery County is not opening until January. And based on what's happening in Georgia and Mississippi, I think all schools should go back virtually because social distancing is not happening in our schools. People have a choice whether to wear a mask, and library services don't matter if you're dead. They just don't. And the thing that's so difficult about COVID is once you're in the hospital, your family cannot see you. My uncle lived 115 days. He was on a ventilator for 40. And for 40 days, no one could see him. And once he finally was moved, he only could see one person for only a certain amount of hours. And he was making a recovery. And he took a severe turn and he died. The rest of my family members were dead within 24 hours of being admitted into the hospital. So this has been traumatic and I can't get over it. So I want people to be safe. I'm not, as a librarian myself, I don't want to go back in my building because the kids, they can't social distance. And I know I'll be fighting with the kids and they don't mean it. So we need to put safety of our staff and our patrons first. And if people would comply with basic things, this wouldn't even be an issue now. But since people will not comply, it's going to continue to be an issue. And even if we do have a vaccine, it's going to take time. I think we're going to be in here for, I estimate, unless something drastically changes, for the next 3 years. And I'm happy that we have Skip at the helm, and we're going to have to be innovative. And at school, we can't even get all our kids to come to school. It is a huge problem, but we're going to stick it out. We're going to support each other, and we're going to make it through.
Thank you for sharing, Ms. Brown, and sorry for the loss as well. Ms. Sandra, did you have a comment to make?
Yes, I do. First of all, we have an excellent staff. I'm very proud of all of them. I think they've worked very well through this whole period. And I think that they've gone above already the call of duty to provide services. So I think we need to think now on their well-being and safety, because, you know, no one's complaining that you can't do anything. Say, for instance, I went to the doctor this morning. I had to sit in the parking lot and wait for them to call me in and take my temperature. 500 incidents of people not wanting to comply with wearing masks and all is appalling. And so I think we need to think of the health and the safety of our staff and our building and scale back to what we need that we can control, so that in the end, we don't have a contaminated building and people who have been infected because some people don't want to comply. So I say we need to do what we need to do to protect our staff. And I applaud them for hanging in there this long.
Thank you, Ms. Solomon. Are there any other members or even presumptive members that would like to speak? I see you, Mr. Harley, that, or even staff members that would like to chime in at this time. So, Mr. Harley.
Thank you. First, a comment. I hope that the press that's here will emphasize the fact that what our scaling back is largely caused by people who are not complying with mask requirements. So that's just really important, that this isn't just a nice thing to shut down on, that is really, really important about that. Then a question, I guess, the question is how are we going to handle appointments for people who are grossly underserved and don't have electronic means to make an appointment?
It's a really good point. Skip and Kathy.
Yeah, I'd like Kathy to speak to that. Thank you.
Sure. So we're still working out the details of exactly how the appointments are going to work. So that's why we need a little bit of time to do that. But when I was brainstorming with our managers yesterday, we are going to encourage customers to call the branch. So they don't have to have a computer to book an appointment. They'll give a call to the branch. The staff will, like they always do, talk to them about what do you need and tailor the services, just like in our strategic plan, tailor the services to what the customers are asking for. Each branch manager will come up with a service plan for what works for their community. So for instance, in Brooklyn Park, when I was talking to the manager there, Catherine McNamara, she said, thinks it's really important that they have some walk-up appointments, because even having a cell phone isn't something that they would necessarily have. So we are definitely aware of that. You know, we want to offer some Zoom programs for people who can do that. That's obviously safer because of social distancing, but we realize that not everyone can. And so we are going to look for lots and lots of different ways to provide the kind of help that each person needs and make it accessible for those people. So very much on our mind. Good question.
I have a question.
Yes, Ms. Evans, and also everyone else, just keep in mind that we're approaching, or we're after 6:15 and we're supposed to be adjourned by now. I just wanted to be mindful of everyone's time. So, Ms. Evans?
Well, I think they've done a wonderful job with the curbside service, but I was wondering whether or not interlibrary loans will have any chance of resuming.
Skip?
Interlibrary loan, Kathy, hasn't that resumed already?
So I think pieces of it have started. We might not have gotten deliveries yet. It's in motion. So I believe it's just ramping up right now.
Penny, I received an interlibrary loan book just the other day.
Well, every time I try to ask for one, it says they're not using them.
So we may need to do something on our arena. We'll check into that.
Okay, thank you. But otherwise, the staff has been remarkable.
You're awesome.
Are there any other comments? With that, I'll ask if all the members can, if possible, if we can see their faces so we can see their hands for the vote. So I would like to make a motion to approve the recommendation of the CEO to go to adopt the Curbside Plus operation model. Is there a second?
Second, Penny Evans.
All right. Ms. Evans, second. All
Yes.
those in favor, please raise your hand. All those opposed? It's unanimous. It passes. Thank you guys very much. And I just want to say in closing, I really want to appreciate everyone from Skip to his executive leadership team, and most importantly to our staff and our partners at the local county government level, and Dr. Kalyana Raman for all their committed efforts to this and their partnership to making sure that we can deliver our mission as the county's public library system to all of the residents of Anne Arundel County. So thank you guys very much. With that, I'll hear a motion to adjourn.
I move we adjourn.
Without objection, so ordered.
Okay, thank you, everyone.
Well.